Welcome to Canada, a North American country stretching from the Pacific Ocean to the Atlantic and up to the Arctic Circle.
Canada's vast land is beautiful, but a lot of it is uninhabitable. That's why most Canadians live in the warmer south, near the United States border. Since its founding in 1867, Canada has grown into a wealthy, advanced, and culturally diverse nation, speaking both English and French.
Like many countries, Canada has a universal government-run healthcare system. This means that Canadians have fewer options for treatment and wait longer for medical care than people in other advanced countries.
Fewer than what? Notice that the narrator doesn't use the term medically necessary before medical care. Canadians don't have long waits for medically necessary care, and certainly not for care that's urgently needed. As for elective treatments like joint replacements, yes, it's absolutely true that Canadians wait a few weeks longer on average than Americans who have the means to pay for such treatments. But millions of Americans, even the ones with health insurance, never get those treatments because of the cost. So because so many Americans are enrolled in high deductible health plans, they often have to pay hundreds, if not thousands of dollars out of their own pockets for the same joint replacement that the Canadians got for free.
Instead of paying each time to see their doctor, all Canadians pay high taxes to fund the whole system.
That is correct. And as a result, Canadians spend far less on healthcare than Americans. Through a combination of taxes, insurance premiums, and out-of-pocket spending, Americans spend $12,914 per capita on healthcare in 2021. Canadians, who only pay taxes, spent $5,905. It's also worth mentioning that American federal income tax brackets range from 10% to 35%, whereas in Canada, it ranges from 15 to 29%. In the US, billionaires like Warren Buffett pay far less a percentage of their income in taxes than middle-class American families do. That's not the case in Canada.
They've been convinced that it's better that way. But is that really the case? This is Marcel. He lives in Toronto with his parents, Aline and Fran.
No, he doesn't. He's a cartoon character. Aside from wanting to brainwash children into supporting a terrible for-profit healthcare system, the reason for this is simple. No such people like Marcel actually exist.
Marcel is a huge hockey fan, and he loves playing online computer games. In his free time, he even designs his own games and posts them online for people to play. His dad, Alain, is a software engineer and has been teaching him how to code. This fall, Marcel will be going to a high school with an advanced technology program. He's excited for the computer programming classes that will prepare him for college and hopefully a career in Toronto's tech industry. Marcel and his family are proud Canadians. During the Olympics, Marcel hangs the maple leaf flag in his window and joins his parents to cheer on his country.
Imagine thinking a kid would find this entertaining. There is not a child in the world, in the Canada, in the US, in Spain, in Namibia, that would look at this and be like, oh, this is cool. I do want to pay more for healthcare. Yeah, cool cartoon.
Marcel's grandpa Henri, who died when Marcel was very young, also spent his life in Canada. After serving in the Canadian Army during World War II, Henri worked as a construction site manager and raised two sons, Aline and Marcel's uncle Jacques. After Henri's death, Jacques moved to the United States, where he works in the biomedical industry. Marcel wonders why his dad and uncle don't talk very much.
The reason they don't talk a lot is because they don't exist. This is basic propaganda technique. The characters all have these little personal details thrown in to create the illusion that they're real. They're not. There's no Marcel. He doesn't have a dad. There's no uncle. It's all bullshit.
Recently, his mom explained that they started arguing after Grandpa Henri died from stomach cancer. Jacques thinks that if Henri had traveled to the United States to see a specialist and have surgery instead of waiting in Canada, he would still be alive. He thinks America's privatized healthcare system is much better than Canada's universal one.
They want you to believe that there are no specialists in Canada who could have treated Henri, which is not true, and that Henri would have waited endlessly for care that could have saved him, which is another lie. Canadians with life-threatening conditions receive prompt care. What they've conveniently left out is that an untold number of Americans don't get the life-saving care that they need because 30 million are uninsured and don't have anywhere near enough money to pay for it. Or they have insurance, but their insurance company refuses to pay for it. Or their out-of-pocket requirements are more than they can afford. So they die.
But Alain disagrees, and the brothers had many arguments. Marcel isn't sure why Uncle Jacques doesn't like universal health care. What's wrong with a government-run system that treats everyone for free? Marcel knows his family pays a lot in taxes, but that's normal in Canada. And what's wrong with waiting weeks or months when you need to see a doctor? That's normal too, right?
Okay, they're using the term government-run for effect. And the implication is that most Canadians endure long waits for needed care, which is simply not true. What they're leaving out is the fact that millions of Americans, even many with insurance, wait endlessly for care, opting not to see a doctor or take a prescribed medication because of the cost, or because an insurance company has denied coverage for the needed care. As a partial consequence of this, the average life expectancy for a male in Canada is 80 years old, but only 73 in the United States. The US has the lowest life expectancy among large, wealthy countries, even though we massively outspend them on healthcare.
To find out, Marcel is investigating the differences between American and Canadian healthcare. And he's discovering some interesting things.
Not an accident that they're not telling you where he's discovering these interesting things.
American healthcare is privatized.
Only some of it, actually. Close to half of Americans are enrolled in government-run programs like Medicare, Medicaid, the VA, although increasingly the government is allowing these health insurers to privatize those programs. And increasingly, America's healthcare system is run by Wall Street.
Which means that, in most cases, people and their employers pay for it, not the government. American healthcare is very expensive.
That statement is true.
But the quality of care is among the highest in the world.
This statement, not so much. You see, while the U.S. has some of the best doctors and facilities in the world, they're increasingly out of reach to average Americans because of the cost. The U.S. healthcare system's performance falls well below average of other countries and far below the two countries ranked directly above it, Switzerland and Canada. The U.S. is last on all domains of performance except care process, on which it ranks number 2. Despite spending far more than any other country in the world on healthcare, Americans experience worse outcomes than people in Canada and other advanced countries, according to the Commonwealth Fund. The U.S. spends a substantially larger share of its GDP on healthcare than any other country.
Unlike Canada, the U.S. has a higher number of specialist doctors compared to general practitioners.
This is true. However, the U.S. also has a much, much higher number of people than Canada, and specialists represent over 65% of the overall physician population. The problem is there are far too many primary care doctors in the United States, meaning Americans often have to wait a long time to get an appointment with a primary care doctor. And many Americans cannot afford to see specialists because of the cost, and insurance companies focus their denials on requests for coverage made by specialists. In other words, just because there are more specialists in the U.S. does not mean that most Americans have access to them.
It also has private clinics where people can pay for treatment and enough X-ray, ultrasound, and MRI scanners to go around.
Yeah, provided you have enough money or good insurance. It's important to mention that the U.S. has an oversupply of imaging equipment. In spite of what you think, that does not translate into lower costs because of heightened competition. If anything, it has the exact opposite effect. Hospitals and other facilities that buy imaging equipment must charge higher prices to cover the high cost of the equipment.
When the doctor orders an important test, Americans don't wait for months like Canadians. They get that test right away. Marcel learned that the United States is a great place for innovation, medical research, and new technology.
This is true. It's also an example of how the occasional true statement can be used very effectively in propaganda. What's admitted is that much of the innovation in the US, especially in pharmaceuticals, is funded by taxpayers and done in places like the National Institute of Health and taxpayer-supported universities. And when it comes to private health insurance in the United States, the most significant innovation in recent years has been innovation that lowers the value of health insurance policies through high out-of-pocket demands, restricting access to doctors, especially specialists, through limited networks and prior authorization requirements. Over the past decade, the out-of-pocket maximum has increased by 46%, and health insurers increasingly use the premiums they collect from Americans to buy back shares of their own stock instead of reducing premiums and out-of-pocket costs.
In Canada, taxes and regulations make innovation difficult. But with low taxes and free market competition, the United States leads the world in developing medical technology that saves lives. That's why Uncle Jacques moved to the United States. He wanted to study biomedicine and work in that field with the government out of the way. Lately, healthcare has become an even bigger headache for Marcel's family. Demand for treatment remains high in Canada, but there are fewer doctors and nurses than ever. So it's been a long time since anyone in the family has gone for a checkup.
As in the US, there is an uneven distribution of doctors and nurses throughout the country. Some places in both countries have an abundance, while others, specifically in rural and remote areas, don't have enough. This is especially true in the US, where there are thousands of medical deserts. One recent study found that 80% of US counties lack adequate access to services needed to maintain health. Also, importantly, Canadians see their doctors an average of 6.8 times a year, compared with just 4 times a year in the US.
What really worries everyone is Alain. He's had nonstop pain in his stomach and lower back. Alain finally scheduled a doctor's visit, but he had to wait several weeks for an MRI test, and the family is still waiting for the results of a biopsy. Marcel is discovering that free healthcare comes with hidden costs. In a healthcare system paid for by taxes, there's a limited number of doctors, hospitals, and high-tech machines. Because no one can pay for their own machines or medical treatment, the real cost is having to wait a very long time. When someone needs a major operation like back surgery or has life-threatening stomach cancer like Grandpa Henri, waiting months for surgery means unbearable pain, and even the difference between life or death.
This here is one of the primary lies told about the Canadian system, designed to make people believe that seriously ill people wait months for life-saving care. It is simply not true. Christopher Hayes is the Chief Medical Information Officer at an academic and research healthcare organization in Canada. Take it away, Chris.
It depends on what do you think you're waiting for. So if you're in a hospital and you need surgery, you don't wait. It gets done if it needs to be done in 30 minutes, it'll be done in 30 minutes. If you need an MRI for care provided in a hospital, you will get it whenever, depending on where you are, because not every hospital has an MRI, but you will be prioritized, and that will happen probably as quickly as it can be done anywhere. It's as the priority drops or is deemed less by whomever, that the waits are how long will you wait to see a specialist after seeing your family doctor. The one that people will talk about is cataracts, hip surgeries, not cancer type surgeries, right, where things will get worse if you don't get treated. And so you can wait months for those surgeries.
This is why Canadians make over 200,000 trips outside their country for medical procedures each year.
Okay, this number seems to come from research done by an organization called secondstreet.org, which is a right-wing outfit that for some reason seeks to discredit the Canadian system. This organization's number is far higher than anything found elsewhere, and their methodology is highly suspect. They also admit the fact that millions of Americans leave the U.S. to get care that is provided in other countries at much lower prices, obviously.
They travel to places like the United States, where they can pay for immediate treatment that will improve or even save their life.
Yet what's not mentioned is that the care Canadians might receive in the US would likely be extraordinarily expensive, and they would almost certainly have to pay entirely out of pocket because they wouldn't be able to obtain health insurance in the US. For patients without health insurance, stomach cancer treatment typically costs up to $50,000 or more. For surgery, and then tens of thousands for chemotherapy and radiation. The costs can reach $200,000 or more, depending on the case. Now that they've loaded us up with lies, the tale of Marcel's big sacrifice really kicks into high gear.
Marcel is worried. If his dad needs surgery, how many months will he have to wait to get it? When Marcel asked his dad if he would ever consider taking the family to stay with Uncle Jacques in the United States, where he could see a doctor and have surgery immediately, Alain said no. He claimed it would be too expensive, and that it would cause Marcel to miss school and lose his spot in the computer programming class that he is so excited about. It's true that Marcel would be disappointed to miss out on his classes, but his dad is far more important to him. From all his research, Marcel is sure that treatment in the United States is the best option, even if Alain still believes that Canada's government-run healthcare system will take care of him just fine. When the biopsy test finally came back positive, the entire family was crushed to learn that Alain had a stomach tumor. He went to Ontario's healthcare board to ask for immediate surgery, and they scheduled it in 5.5 months. Alain's pain was already so bad, and there was no telling how much worse the tumor might get in 5.5 months. Marcel didn't want his dad to end up like Grandpa Henri. One evening, when he was designing a game to cheer himself up, Marcel found a solution, but he'd have to make a sacrifice. The next morning, he spoke to his mom about it, and then he called the school with the computer programming class and told them he would not be attending in the fall. At first, Alain was very upset. He knew Marcel worked hard to earn his spot at the school. But Marcel said he'd much rather give it up and live in the United States for a bit, if it meant his dad could get surgery right away. Uncle Jacques immediately agreed to host his brother's family and help him schedule the procedures he needed. Now, Marcel is confident. He knows that with immediate surgery, his dad's chances of making a full recovery are very high.
And while Alain still believes there are some good things about Canada's universal healthcare system, he's proud of Marcel for doing the research and making a tough decision. His son's sacrifice gave him the push he needed to travel for healthcare without shame, like many other Canadians.
And there it is. Marcel saves his father's life by bringing him to the United States for a vital, life-saving medical procedure. There's only one problem. If a real Canadian family actually did this in the real world, additional testing would need to be done by American doctors, and the cost would be in the tens of thousands because Marcel's father would not be able to get U.S. health insurance. Even if the process could actually move that swiftly, only the very richest Canadians could afford to do what you've just seen. I'm talking like Celine Dion. Meanwhile, in the real world, kids in America have to drop out of school every day because their families are saddled with medical debt and bills. The system is stupid. It's the single greatest grift ever perpetrated on mankind, and may God save us.